Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is July 19, 2025. This video is on two New England Journal of Medicine articles published on July 16, 2025. The first titled Rapid Recovery of Donor Hearts for Transplantation After Circulatory Death. And the second one, on-table reanimation of a pediatric heart from donation after circulatory death. DCD, or donation after circulatory death, heart recovery methods include direct procurement and perfusion, or DPP, and normothermic regional perfusion, or NRP. Both raise logistical or ethical issues. The rapid recovery and extended ultra-oxygenated preservation technique, the REUP technique, avoids NRP and ex situ perfusion. 3 adult donor recipient pairs were studied. Flush circuit used 2 liters of oxygenated red cell based delnido cardioplegia delivered at 80 millimeters of mercury over 10 to 12 minutes. All donors were less than 35 years of age. Cold ischemia time was less than 4 hours. The demographics, the donors were 16, 25 and 31-year-old males. The recipients had severe cardiomyopathy or prior LVADs. 2 needed dual organ heart kidney transplants. Statistics, detailed pre and post-op hemodynamics were recorded. All hearts were successfully transplanted. What did they find? All 3 recipients had normal biventricular function at 7 and 120 days post-op, no primary graft dysfunction, no acute cellular or antibody-mediated rejection, p-value 0.05. Limitations, only 3 cases. No physiological assessment possible before transplantation due to lack of reanimation. Key takeaways: avoids the ethical pitfalls of NRP. No need for expensive ex situ perfusion. Suitable for well-selected DCD donors aged 18 to 40 years. Enables DCD heart transplantation in restricted settings. The next article is Pediatric On-Table Reanimation, a life-saving innovation. Pediatric heart transplant waitlist mortality is high. DCD with NRP underutilized due to ethical concerns. On-table reanimation circuit developed for small pediatric hearts. A 1-month-old donor heart reanimated ex vivo using a customized circuit with roller head pump, oxygenator, and LV ventilation. Preclinical testing, porcine hearts were reanimated within 3 minutes. Human donor heart restarted in less than 2 minutes post-cardiectomy. Total reanimation time 5 minutes 39 seconds. The recipient was a 3-year-old girl with viral myocarditis, multiple complications on VA ECMO. Results: successful transplant, normal echo at day 1 and 3 months, no graft dysfunction or rejection. Limitations: only 1 case is a case report. Long-term follow-up pending. Ethical concerns around resuscitating a heart after declaration of death remains unresolved. Key takeaways: offers DCD transplant access to centers where NRP is banned, allows function assessment via echocardiography, technique is scalable for centers with limited resources, critical innovation for pediatric transplant survival. So briefly, DBD is donation after brain death, organ perfused continuously. Death is equal to irreversible brain function loss, while DCD, organ recovered after cardiac arrest, there's a risk of warm ischemic time. Brain death is not a consideration. There are ethical debates around reanimation and the permanence of death. In the US, the DCD donors, there are 72,000 donors, while DBD 9,700 donors, but only 17% of the heart transplants are DCD hearts. The outcomes: the 6-month survival is around 90 plus in both. In DCD, it's about 89.5% for 5-year survival. DBD about 80%. So global trends: in the UK, DCD accounts for 46% of the donors, The key takeaway is in DBD, which is the traditional way, there was irreversible cessation of all brain function. The donors were kept on ventilator to maintain perfusion. In DCD, irreversible loss of circulation and respiration, with death declared after 2 to 10 minutes of asystole. Who knows about the brain? If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.